Hi, my name is Mifsusu. I chose this article because I'm waiting for a state in the sonography program, and I do have an interest in breast cancer. By definition, this cancer is cancer of the cells that release hormones into the blood in response to a signal from the nervous system. It's a rare cancer. It has a zero point 0.7 cases per 100 people, so it's very rare, and it's found in the bronchopulmonary system and gastrointestinal tract, but it can also be found in the breast, which account for 0.1% of all mammary cancers. It's seen in people in the ages of 60 to 70, but it can occur in people who are young too. There are two types of neck, which is pure form, which means it's composed of neuroendocrine cells, and the other form, which means it's less differentiated, which is the composite form. So it's normally diagnosed through sonography, which can show this hyperechoic, which means it's dense, has regular shape, it's maculobulated, which means that it's malignant, almost cancer, and it has normal cell transmission. So histologically, it invades the adipose tissue, which is the fat tissue. It's richly vascularized, which means that it has a lot of blood vessels that feeds into it to grow. It's monomorphic, which means that it's just one type of cells, not multiple cells, and it has irregular nuclei and mitotic activity, which essentially means that its cell divides at a rapid rate. So how to diagnose this is all based on immunohistochemical analysis, which is essentially a broad term for grabbing a sample from the human body, staining it to see if there's antigens that express certain things, which can show you things. For this case, in neuroendocrine markers are chromonogen, cyanotyphosin, and CD56, 57, which basically can tell you what type of cancer it is. So with immunohistochemical analysis, they just perform it using paraffin blocks, which can identify the antigens on there. With the leukocyte markers, it tells you whether or not it's a composite or a pure form using the markers CTF1 and CDX2. And once again, with sonography, it can tell you the shape, size, and localization of the breast cancer. So this case is about a 13-year-old Togolese girl. She had no family history of any cancer, especially breast. When they did her breast examination, they found that it was located in the right breast. It was growing for 7 months, and it was 7 centimeters firm, and it was mobile, so it moved around. She had no skin abnormalities or nipple extraction or abnormal nipple discharge at all. So she was too young for mammogram, so they just did a regular ultrasound. So it did come out to be hyperechoic, which was dense. It was very oval mass and it was very maculobulated, which means that they really thought it was malignant. So with that, they gave her initial diagnosis of an atypical adenofibroma, which is a cancer that's composed of glandular and fibrous tissue. So they thought it was. So to get more better understanding, they did an ultrasound guided biopsy using a 16-inch core needle. With that done, they found that it was a diffuse tumor perforation, which means that it was infiltrating her entire breast. And then, so they were like, okay, it has to either be a primary malignant non-Hodgkin's lymphoma, which is a cancer that affects the lymphatic system, which is crucial to the immune system. And all they thought that it was an undifferentiated carcinoma. So they did immunohistochemistry on it. So they took it with the paraffin blocks and sent to France. The results came that it had infiltrating ductal adenofibroma, and they knew that because it expressed the marker cytokeratin, which also confirmed that it was the composite form of the breast cancer. For furthermore evidence, they saw that the antigen CD56 and 57 and chromogen confirmed that it was neck because it expressed the membrane epithelial composites of it. So with their leukocyte markers, it was negative for TTF1 and CDX2, which also confirmed it was not non-Hodgkin's lymphoma and it was a composite form and not the pure form. So overall, the 13-year-old girl had a composite form of her breast neck. They did treat it with surgery by removing the mass and chemotherapy. Unlucky for her, this cancer has a very poor prognosis, so she ended up dying after 5 months because the cancer did come back and it metastasized through her whole body. Overall, this is a case about how immunohistochemistry can be used to distinguish between composite and or pure form of breast neck in a 13-year-old girl with this type of cancer. The end.